Hello, this is a virtual microscopy slide of a solid pseudopapillary neoplasm of the pancreas. This entire section is composed of tumor and we don't see any normal pancreatic parenchyma. Usually this lesion is fairly well circumscribed and we will see a sharp demarcation between the tumor and the surrounding or adjacent non-neoplastic pancreatic parenchyma. At this low magnification, we can see that there are several different appearing areas. For example, on the top left, this area looks somewhat more solid. And in this left middle aspect, we can see that there is cystic change. This will be reflected on imaging. And on the right, we can see that in these areas, there are some of these clefts. And this is because there is a papillary or pseudopapillary architecture. Let's first have a look at this more solid area, and we can see that the lesional cells are actually arranged in these very loose islands or nests with some fibrous stroma in between the nests. The cells are polygonal in shape and they contain rounded to oval-shaped nuclei. The nuclei are relatively uniform and the cells have fairly abundant, pale, eosinophilic to clear cytoplasm. In some areas, we can appreciate longitudinal grooves in the nuclei. Some of the nuclei also contain small, but not very prominent nucleoli. In this better preserved area, we can see that the cells are arranged in rather loose sheets, and we can see the uniform round to oval nuclei. Let's look at the more pseudopapillary area. So in this area, as we zoom in, we can see the formation of these very slender papillary structures. The pseudopapillary structures are composed of a slender fibrovascular core. Over here, we can see a very slim vascular space and a little bit of fibrous tissue around it. And the tumor cells are attached to this core, but they appear to fall off very loosely, so that there are some tumor cells that appear quite detached as well. And as we move around, we can see more of these pseudopapillary areas. Over here, we can also see these very loose pseudopapillary structures. And this is one that's cut in cross-section, and we can see the small vessel in the fibrovascular core. Again, the cells contain mostly oval nuclei, and we can see a very clear longitudinal groove in this particular nucleus. Sometimes the cells also contain hyaline globules within the cytoplasm, and for example, in this area, we can see some of the cells contain numerous pinkish rounded hyaline globules, and these are usually positive for the PAS stain. Another area here shows these globules within the cells. And these are not to be mistaken for red blood cells, which are found in blood vessels and look a little bit different. Again, we can compare the red blood cells to these hyaline globules that are found within the cytoplasm of the tumor cells. And in this particular area, we can see two oval nuclei with very well-formed longitudinal nuclear grooves. Let's learn a bit more about solid pseudopapillary neoplasm. This tumor is also known as the solid pseudopapillary tumor or the Gruber-Franz tumor. It generally has indolent behavior with low malignant potential, and this tumor is much more frequent in women than in men, particularly in young women. And sometimes when they do occur in males, they tend to occur in the older age group and may be more aggressive. Clinically, these tumors are often asymptomatic, so they are often picked up incidentally on abdominal imaging. And you can see in this picture, this is the very well circumscribed tumor, and here is actually the spleen, so this is in the tail of the pancreas, and there are these very loose cystic areas. Grossly, the tumors are often located in the body or tail of the pancreas as a well-circumscribed, rounded mass, and the cut surface, and you can see in these two different examples, have variably solid and cystic loose areas. Sometimes they can appear very friable, as if there are bits of tissue that are falling out. These labeled gross pictures, together with more labeled microscopic pictures, are found in Pathweb, our free online pathology resource. Registration is completely free, and the link is in the video description. There is also a separate video describing the gross features of solid pseudopapillary neoplasm using virtual pots or virtual pathology specimens that are in our virtual pathology museum. Microscopically, there will be more solid and looser areas, just as we saw, and the tumors usually form sheets of fairly uniform cells. In the looser areas, for example here, the tumor cells form pseudopapillary structures. Here is a higher magnification view showing the pseudopapillary structures. You can see a nice vessel here within a fibrovascular core, and the tumor cells that are very loosely attached or falling off these fibrovascular cores. The cells tend to be relatively uniform, and some of the nuclei can contain longitudinal nuclear grooves, as you can see here, and also here in this high magnification picture. And as I showed earlier, we can also sometimes see these cytoplasmic pinkish hyaline globules in the tumor cells. Very frequently, the tumor stroma may also show degenerative changes, for example, hyalinization, a very pink, glassy appearance of the stroma. There can often also be cholesterol clefts, as you see here, these slit-like spaces with associated foamy macrophages and even calcification. So on imaging, the classical features would be cystic change and sometimes calcification and a well-circumscribed rounded tumor mass. In summary, this is a solid pseudopapillary neoplasm of the pancreas, which is a tumor that is of low malignant potential with indolent behavior, and very often we would see areas that appear to be more compact with a more solid growth pattern of nests or sheets of tumor cells, and we will also see looser areas with a pseudopapillary architecture where you can see these slender papillary structures that are covered by loosely attached tumor cells. The tumor cells are fairly uniform with round to oval nuclei and sometimes longitudinal nuclear grooves. Also, secondary changes such as calcifications, foamy macrophages, cystic change, and cholesterol clefts are frequently seen in this tumor. Thank you.